We're now here at the Masters of Laser Dentistry in Irvine, California on June 4th. And Nikki, we'd like to ask you, how was the Masters of Laser Dentistry course, and what are your thoughts, and what would you like to share with everyone else?
The course was a very thorough course. As far as a hygienist goes, it really did touch on hygiene. For me, I need to see the science behind the laser so I can have a little bit of knowledge myself so that I can take that knowledge and be able to explain it to the patients. Not scientifically, but enough that they understand it, because if a patient understands what you're trying to sell them, then you're not really selling them. You're actually helping them out and you're providing them a service. And when the patient's on board, they're more likely to have more follow-through when it comes to their own care. So for me, I needed to see a lecture because I wanted to have the background information that I needed to be able to speak to my patients with knowledge so that they put their trust in me and I gain their trust. And like I said, then they have more of a follow-through with it. The doctor's course was perfect as far as it did really get into hygiene, which was nice. I was afraid sometimes these kind of courses pay a lot of attention to the DDS and the tissue cutting and the bone cutting and all that sort of stuff. This one really did focus on hygiene, which was nice. But no, I was very thrilled with the course. The breakfast was great. But it really did help and touch on the hygiene topics that we needed to be touched on. So I feel now I can go back to my office and use a laser feeling confident that I know what's going on. Before, I had a doctor say, go ahead, use it. And I said, well, do you want me to use it on you? Because I don't know what the heck I'm doing. But now I'll be able to take that information and use that in both of my practices, which is nice. But I think this is really going to help value me as a hygienist to give me more production in the hygiene department, because I'll be able to treat patients more comprehensively than just going in and scaling them or scaling them and replaying them. This way I can actually use the laser and utilize the laser for bacterial control. So for me, it just kind of more well-rounds the treatment that I'm going to be doing for my patients that are going through therapy. And hopefully, if all goes well, I'm going to have better outcomes for these patients, along with it'll be a more comfortable experience for them if he's telling the truth. That's about it. Can't say enough about the class. It was great.
Thank you so much, Nikki.